So hi everybody, good evening. I think we'll start now. And again, today's masterclass is very special for us since we have a lot of exciting things coming up. Um, Let me just share my screen now. So today is going to be introduction to our live masterclasses, and the topic will be personality disorders. And we have a couple of important announcements to make, which we will get to it hopefully. Firstly, again, thank you all for joining in. Thank you all for your constant support. We hope to have a fruitful masterclass. As always, let's set some ground rules. What you should be expecting is relevant guidelines will be taken down, it'll be broken down and made easy. What do I expect from you? I want you to be as interactive as possible. I need your thumbs ups. I need your answers, no matter how wrong they are, no matter how stupid they are, because no one is going to remember what you have answered. The idea is to take as much knowledge as possible. Whom should you not be? You should not be this guy who's just writing everything down that I'm saying. Trust me, everything that I say here, you have read somewhere. The idea is to actually learn and decipher out of what you have actually read, so how we can apply it in our MCQs. If you have not muted yourself, please mute yourself, or Alia, if you can manually mute them. How can you use these master classes effectively? So everything that I say will be from the guidelines. So just be calm and listen. Answer as many questions as you can with the best of your ability. And again, don't be this guy. Yeah. Listen to me, hear me out, understand what I'm trying to say. Yeah.
Okay, before that, to all our new members, welcome to Steady Study. This is a place built by IMGs for IMGs. So we have cleared the MCQ ourselves. So basically, we have made an attempt to make your preparation a bit easier, okay? And I hope you guys feel that this session is fruitful. You will get a lot of knowledge. And yeah, we guys are always there to help you out. So I'm trying to keep it short because, we are running late, but yes, I hope you guys enjoyed this session. And if you have any doubts, you can DM us on Steady Study. And yes, let's begin. Over to you, Farhan.
Yeah. Thank you so much for the introduction. So that was all about us. Now we'll begin with the personality disorders. And you have to understand, because psychiatry is something that might appear to be very subjective, even if you know the concept behind it. So we'll apply using MCQs today, and we'll see what we have to take from them. So when we essentially talk about personality disorders, we broadly divide them into type A, B, and C. For the exam purpose, you don't need to know what comes in type A, what comes in B, and what comes in C. What you need to know is what actually do they mean. So when I say type A, I just think of one word. When I say one word, I mean weird. Weird. Okay. So if a STEM has a person who's acting weird, you need to understand that it's type A. Yeah. Now, what does paranoid mean? And I'm pretty sure paranoid is very self-explanatory, because we use these terms on a daily basis as well. So paranoid is somebody who refuses to share personal details. Yeah, it's a guy who's persistently in suspicion. So if I have to just describe this person in one word, it's persistent suspicion, or as we say, sus. He's sus about everything. He's sus about everything. He'll see his co-workers, you know, talking to each other, and he might feel that these people are actually talking about me. They're planning something about me. Everything that is going on is something against me. So that is paranoid, and it is very self-explanatory. Now let's talk about schizoid. And if I were to explain schizoid in one word, it's basically a happy loner. A happy loner. Yeah, a happy loner. So this guy, he's alone by choice. He likes being alone. And you have to understand this very nicely, because in type C, there is one who is avoidant. And there is a big difference between schizoid and avoidant. And that is where AMC is going to play their game. But it's very easy if you understand what a happy loner means. He is alone by choice. Alone by choice. So as you all might have seen Dr. House, he does not care. He does not want people to be around him. He is alone by choice. He does not care. Yeah. Now, what does schizotypal mean? And schizotypal is something that, a guy who has eccentric thoughts and odd perceptions. So, if I were to describe it, he has eccentric thoughts and he has very odd perceptions. He will say things like sixth sense, you know, fortune teller. For example, if I were to, solve questions, and every time we solve questions, I ask you guys that why do you think this option is right? And then you guys give me your logical reasoning that, because this is there. You have seen double bubble sign, which is why duodenal atresia. I've seen Down syndrome, which is why this. But what if a person tells me that I have chosen option A because the moon has guided me to? Or I have chosen option A because God wants me to choose option A. A person who has eccentric thoughts, his perception is completely odd, completely irrational. That is a schizotypal, someone who has magical thinking. So this is schizotypal, and type A has three: paranoid, schizoid, schizotypal. Is this clear up till now? Is it clear up till now? Can I see a bit of thumbs ups? Yeah. Are you guys in sync? Amazing, amazing, wonderful, perfect, perfect. Thank you so much. It loves, I love it when you guys show your thumbs up, when you guys show support. So I know that you guys are all active. Yeah, amazing. Let's move forward. Let's talk about type B. Now, type B, if I were to describe in one word, if I had to give you one word, the first one, type A was someone who was weird. Type B is someone who is wild. So this is type B. This guy is wild. Yeah. Now, what does antisocial actually mean? So, a man who has no regards for one's rights. He has no regards for one's rights. No regards for one's rights. He is involved in illegal activities. And he has this feeling that I can do this because I can. And you have to understand this very nicely because AMC is going to confuse you here. I'll show you how when we solve questions. He'll say, because I can. I will break the law, I will break the red signal because I can. Who's going to stop me? Even though that idiot doesn't know that there are so many people who can stop you, there are so many people who are smarter than you, but that idiot feels that I'm the smartest guy. Yeah. So he has no regards for anyone's, uh, rights. So these people, they are basically more than 18. What if I tell you that there is a child, there is an adolescent between 18, between 10 to 18 years? What would this be? A child who's between 10 to 18, he has no regards for anyone's rights. He feels that I can do things that are illegal because I can. What do we call this person? Can anyone answer? Do you know? If more than 18 is an antisocial disorder, exactly. So it's a conduct disorder. It's a conduct disorder. Yes, absolutely. Perfect. It's a conduct disorder. What if there is a child who's less than 10 years old? And this is one of the most famous questions AMC has been testing in the recent months. What if there is a child who's less than 10 years old who has the same feeling? Yes, that's ODD. Oppositional, defiant disorders. It's a child who's less than 10 years old and he still has the same feelings. Yeah. Now, usually what AMC does is AMC will try to confuse you between ADHD and between oppositional defiant disorders, because usually clinically both will present in a very similar way with a very subtle difference that we'll see when we solve MCQs. So there was this question that was asked in one of the recalls that I could find, that there is a child who's being brought by his parents, that he has threatened them with a knife. And in the past, he has done arguments on minute issues. He even ran away from home once. Parents admit that they have used physical punishment for him in childhood. What would you do initially? You will do a mental evaluation, you will do a physical evaluation, or you will take a collateral history. What do you think? And give me answers with reasons. What is your answer and why do you think that answer should be correct? Come on, guys. What will you do for this child? A, B, or C? Mental evaluation, physical evaluation, collateral history. Come on. I'm waiting for your answers. I'll give you a minute. Give me the most random thought that you have. Come on. Give me your most random thought. A, B, or C? Mental evaluation, physical evaluation, I see no answers. How is it possible that study live class has no answers? Because usually you guys are very smart. Collateral history. I see C's. But why? Why? Why would you do C? What are you differentiating this situation from? What is the one thing that you are absolutely looking for? What is that one thing that you are absolutely looking for in a collateral history? What if you are in AMC Clinical, you are in AMC 2, and this thing has come to you, and you have to take a history? What do you think your history will be based on? So Nazneen says trigger, which is partly correct, but there is something which is more deeply rooted. What is the one thing that you are looking for absolutely in this history? So option C is correct. Again, so truth triggers, okay, you are all right, but you have to see that in the history, is this child also having the same behavior at school? Is this child also having same behavior at school? Now, why is this important? Because if he is normal with his teachers and with his friends, but he is only behaving like this in with his parents, it means that we are evaluating for child abuse. And if it is child abuse, you have to report it to child protection services. So what you have to evaluate is this only at home or is this in public as well? Because if this is in public, it means that it is a type of a personality disorder that we have to, look for in our further consultations. But if this is a behavior that is only and only happening at home, it means that there is child abuse that we have to look into. And if need be, we have to inform the child protection services. Is that clear, guys? So now do you understand why do we have to take a collateral history? Yeah. So even if they now twist the question and give you an ethical scenario, you'll be able to answer. Yeah. So this is how you have to apply your mind. Now a mother is presented with complaints about child not listening to her, and the child maintains eye contacts, refuses to sit still, especially at dinner, and teachers at school are yet to notice the behavior. What is this? Is this ODD? Is this ADHD? Is this autism? This is ADHD because the answer is marked. I want you to tell me why this is ADHD. Come on, tell me why do you think this is, what is the one thing? What is the one thing that is not there in the scenario? And if I had to absolutely differentiate between ADHD versus an antisocial or an ODD, if I have to differentiate between ADHD versus ODD, what is that one thing that I'll be looking for? No, eye contact, no. These are all recall people. You will see on the group, they'll say, if you see eye contact, if you don't see eye contact, this is this. If you see eye contact, it is that. No. Because then eye contact, I can then take you to Asperger. I will also take you to Asperger syndrome if you talk about eye contact. So no, don't talk about eye contact. What is that one thing that you will see? Consistent behavior? No. It's basically aggression. Aggression. Simple. Simple, yet so deep. If you see aggression in a child, then that is more towards ODD. And when we'll solve questions, I'll tell you. Yeah, when we'll solve questions, yes, Nazneen is correct against authoritative figures, which is absolutely correct. So that is aggression against someone who has an authority, which is correct. So aggression is what will primarily differentiate between ADHD and ODD. Perfect. You guys get this? Yeah. Now let's move forward. What is a borderline personality? So borderline personality is something that, um, a person with mood swings, let me type their characteristics down. Let me write their characteristics down and please note it because these are actually the words, the key words that AMC will be giving you in the scenario. Somebody with mood swings, he's happy now, sad and angry in the next minute. Someone with compromised interpersonal relationships. Someone with an inability to hold jobs, malingering, a guy with, who has a fear of abandonment. Please note these words. Every single word is a recall. Behaviors of self reassurance. For example, if there is someone who's in jail and he constantly writes, I am okay, I am okay, I am okay. These are behaviors of self assurance, because they have a fear of abandonment. Everything is linked. And when we solve MCQs, you'll understand behaviors of self assurance, you know. And a very important thing and a very heavily tested MCQ is, what is one defense mechanism that these people use? What is one defense mechanism? Now that is splitting. And in the live classes, we'll be also getting in, deep into what defense mechanisms are and how defense mechanisms can actually help you to guess what personality disorder this person has. So basically, splitting. Now, what is splitting? I'll explain very easily. Suppose there is this patient who has come to your hospital. She says that the doctor is, perfect. The nurses are absolutely bullshit. So splitting means that there is either black or white. There is no gray. What I mean is, steady study is perfect, another institute is completely bullshit. They won't have terms like, this is also okay. You could also try that. This is something that could be done. That could be, would be is not there. It's either black or it's white. There is no gray land between these two feelings that they have. So this is what splitting is, and this is what people with borderline personality disorder have. They'll come to your hospital, they'll say, doctor, you are absolutely perfect, but your nurses, they're all bullshit. None of them is nice. This is splitting. You guys get this? Yeah? Do you understand what splitting defense mechanism is? Yeah? Come on, guys, thumbs up. You guys are all sleepy. This is not the way our master classes work. Come on, guys. Yes. Perfect. So that is splitting defense mechanism. But antisocial personality disorder and bipolar personality disorder, they are so resembling. So what is that one thing that differentiates both of these? Can someone answer? What is that one thing that will help me differentiate between an antisocial personality disorder and someone with bipolar, with borderline personality disorder? That one word that I'm looking for. Come on, come on, guys. And it is very easy. I've already mentioned it. You guys just have to search your minds for that file. I've already said this. And it's really simple. Criminal mindset building, okay, but a person with borderline personality does not actually want to harm people. He cannot control it. So even if this guy is doing something illegal, he cannot control it. But a person with antisocial personality, he does it because he can. He can control it, but he does not want to. He does it out of his own will. You guys get it? He does it because he can. This guy, he can't control it. He wants to, but he cannot. Yeah. Now, very important question is, what is the gold standard management of BPD? And that is dialectical behavioral therapy. Yeah. Cool. So these two are actually very tough topics, but we have broken it down into simpler words, and we'll also solve MCQs so you'll understand better. Yeah. What is a histrionic personality? So if I had to, describe a person with histrionic personality, I will give you a few keywords. This person will dress to impress. always wants to be the center of attention. He cannot dare people talking about someone else. This person is absolutely flirtatious, seductive, self-centered, and bothered about physical behavior, physical appearance. Physical appearance is utmost important. You guys get what a histrionic personality is? Someone who's come to your clinic in absolutely red clothes, top-notch nail polish, top-notch lipsticks, telling you, doctor, crisp, you look smart, you're looking absolutely stunning. For example, a patient comes to me, tells me, Dr. Farhan, you're looking absolutely amazing, absolutely handsome. Tells me, if I look at my computer to jot down the history, she'll feel very offended that why is he looking at the computer screen? Why is he not looking at me? So this person wants to be the center of attraction at all times. She will dress to impress, or he will dress to impress. He wants to look crisp every time and wants everybody to talk about them. So that is a histrionic personality. Do you guys get this? You guys understand what histrionic personality is? Yeah? Cool? Amazing. Amazing. Now, what is avoidant? Now I'm in cluster C. Yeah, now I'm in cluster C and I left one. I left narcissist. Now, narcissist, I think, is pretty explanatory. Narcissistic is somebody who feels that they are the best. They are the best at everything they do. Nobody can do anything that is, better than them. If you tell them, if you rationally reason with them, they don't care. So that is a narcissist. A man actually believes that he is more important than anybody out there. That is a narcissist. I think it is very self-explanatory. Even we know in our lives, we know many narcissists. So I think that is very easy. Now in type C, we have if I had to again give a word for type C, is someone who's worried. So we had A who was weird, A was weird, B was wild, C is worried. Now this guy, the first one is avoidant. Now you know why he's avoidant? What is the difference between a schizoid and an avoidant person? An avoidant person will be, I want to be friends with you, but I am scared that you will reject me. I want to be friends, but I am scared of rejection. So schizoid genuinely does not want to be friends with me. He does not care. You can buzz off. Avoidant wants to be my best friend, wants to approach me, but is scared that I will reject them. So that is avoidant. That is very easy to differentiate between an avoidant and a schizoid. A person who is a happy loner, I don't care, is schizoid. Who does not actually want to be alone but is alone because of rejection is a person who is avoidant. Yeah, is that clear? This person is hypersensitive to criticism. Hypersensitive to criticism. Can't take criticism. Even if you tell them that, I feel that you could have worked a bit harder, they'll take it to heart. They will start, avoiding you. They'll go in their shell. They're basically timid. Yeah. Now, what is an OCPD? Obsessive compulsive personality disorder. These guys are perfectionist. And this perfectionism is egocentric. Can somebody differentiate OCPD from OCD? Obsessive compulsive personality disorder from obsessive compulsive disorder? Can somebody differentiate that for me? Because this is where AMC will play you and has played everybody. OCD versus OCPD. And the answer is in front of you. Give me that one word that I'm looking for. Come on. Srijana has given me a very beautiful answer. She said that a person with OCD is ego dystonic. And these people are ego syntonic. Now I'll explain this to you later in MCQs. Yeah, just remember ego syntonic, ego dystonic, because this question has repeatedly come, which is why I wanted to address this question right here, right now, that OCPD is ego syntonic, OCD is ego dystonic, and you need to understand the difference between ego syntonic and ego dystonic. Yeah. Now, what is the last one is a dependent personality. Someone who's always dependent on everybody. They need support. They need support for everything, and they have a very low self confidence. So dependent is really simple. Now, if I were to ask you, just generally, whom do you think will make the best couple? Which two personality disorders is going to make the best couple? People with what type of personality disorder should actually get married? If I were to ask you, if I were to, just, quiz you, humor me. Whom do you think two personality disorders that should get married? Humor me, guys. Come on, give me your most stupid answer because this is a very stupid question. So Srijana, amazing, amazing. So a narcissist and a dependent. Yes, a narcissist and a dependent should get married because a narcissist feels that you know, I am right in everything. I am the best. No one's better than me. A dependent wants that narcissist because she's dependent on that narcissist for everything. Yeah. So narcissist and histrionic, so a narcissist and dependent make the best couple. Yeah. Cool. Amazing. Perfect. So are all the personality disorders in place? Can we go ahead and start with the MCQs? Yeah, I want a thumbs up. I want a thumbs up. I want to know if everyone is active, alert, oriented to time, place, and person. They have a good GCS of 15. Yeah, amazing. Amazing. So, first question. A 25-year-old educator Farhan and his co-founder Alia hosting an informal session for AMC aspirants. When a student asks them to prepare from, when a student asks them where to prepare from, Farhan leans forward and confidently says, "Study, study." Alia adds, "Only study, study. Everything else is just noise." Over the next 20 minutes, they enthusiastically talk about their teaching methods and how they have completely changed the AMC scenario for AMC preparation. When someone mentions another resource, they exchange a small smile and they say, "That's cute." They repeatedly steer the conversation back to their achievements, clearly expecting admiration. When someone tries to shift the topic, Farhan cuts in with, "Anyway, as I was saying about us." Now, physical examination is unremarkable and ego examination is notably enlarged. Which of the following is the most likely diagnosis? A. Antisocial personality. B. Avoidant personality. C. OCPD. D. Paranoid. E. Schizoid. F. Narcissist. G. There is no personality disorder. This is the truth. What are your answers? So one said A, one said antisocial. Antisocial. So everyone saying F has actually, I'm very sad if you say S, if you say that narcissistic, because I was fishing for G. I was I was fishing for G. So you guys feel G is right? Do you guys feel G is right? Yeah? Is G correct? No, G is wrong. One person said C, oh, obsessive compulsive personality. No. So again, this is a narcissist. Every time study, 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 which is right, but okay. A 24-year-old comes to the emergency department after injuring his arm. Following an argument with his girlfriend, the patient broke a vase and used a shard of glass to cut his wrist. He says, "I wasn't trying to kill myself. I just don't know how to deal with my anger." The patient says that he struggled with depression and anger problems since he was a teenager that has led to difficulties with romantic relationships and has caused him to get fired from jobs. He was hospitalized at the age of 17 for suicide attempt. The patient's bouts of depression are too numerous to count, and he explained that his mood shift is unpredictable from 1 minute to the next. Previous medication trials of fluoxetine and sertraline were ineffective and caused sexual side effects. He does not currently take any medications. The patient has a 2 centimeter superficial laceration on his left forearm. Physical examination is otherwise normal, and he has no suicidal ideations, hallucinations, or delusions. Which of the following is the most appropriate treatment for this patient's condition? Your answers in the chat box. You have 1 minute to answer. So someone said D because of bipolar disorder. Is this bipolar 2? Is this bipolar 2? I don't know. You have to tell me. So all in favor of C are correct. It's dialectical behavioral therapy. What is the diagnosis? What does this patient have? Now it's easy. He has borderline. Now you guys are going to tell me what are the keywords. What are the keywords that led you to the diagnosis of borderline personality? Because I'm not going to give you a thump on your back, amazing, you chose borderline personality. No. You have to tell me why this is borderline personality. What are some words that I told you to look for and you came to the conclusion of borderline personality disorder? What are the keywords? Can't hold relationships. Okay, so I'll write it. Can't hold relationships, mood swings, poor interpersonal relationships. Pardon the writing. Poor interpersonal relationships, can't hold jobs, can't deal with anger. What more? Am I missing something? You've missed a very important thing which no one has told me till now. I don't understand why. Self harm, yes. Self harm. Mood swings. So is this not very easy now? Diagnosing a borderline personality with the keywords that I've given you. Is this not easy? Yeah. So he came, he had an argument with his girlfriend. Okay, so this is, poor interpersonal relationships. The patient broke a vase, used a shard of glass to cut his wrist. Okay, so I see suicide attempts. I wasn't trying to kill myself. I just don't know how to deal with my anger. So he can't control it. So now you are sure that this is not antisocial personality because he does not know how to control it. Yeah. The patient says he has struggled with depression and anger problems. Okay, he has anger problems. Amazing. I hate the new update of good notes. I just hate it. Since he was a teenager, that has led to difficulties with romantic relationships. Okay, again interpersonal relationships, and he cannot hold jobs as well. Okay. Bouts are too numerous to count. A lot of nonsense written there. He has no suicide ideations, delusions, hallucinations. So what? Why is this important? Why is this information important? Why is this very important? What are you differentiating from? So if I were to say this differentiates it from antisocial personality disorder, what does this differentiate it from? Come on, you guys. To rule out depression, Adishri says schizophrenia, which is perfect. This is basically to rule out schizophrenia. Perfect. Amazing. So you guys are in sync. You guys are making me happy. You guys are answering, which is all perfect. Amazing. Good. Now you are a GP in a regional hospital at night duty. Your next patient is a 24-year-old female who is brightly dressed and overtly attention seeking. She complains of having a mild headache since the last 1 hour, and she becomes angry when you're looking on your computer screen for some information regarding the patient. Which of the following is correct about her diagnosis? A, B, C, D, E. Patient with this disorder usually lack emotions. There is no genetic link for this disorder. Patient with this condition usually use repression and dissociation. Style of speech is usually detailed. This disorder usually does not exhibit seductive or provocative behavior. Come on. I see C. I see only one answer. I see another C. Why C? I see D's. Okay. I see D's and I see C's. I see D's and I see C's. I see B's. Okay, I've seen B as well. So all in favor of D. Thumbs up. All in favor of D. So you're all absolutely wrong. It is not D. Now let's understand why not D. Style of speech is usually detailed. What does this mean? So this basically means that, if a person says that that party was amazing, That party was wonderful. Is this detailed or is this generic? Is this detailed or is this generic? If I tell you that I had gone for a party yesterday, but the party was amazing, is this detailed or is this generic? Come on, I see generics. I want more answers. It is very generic, right? So these people, they are not very detailed. If they get into the nitty gritty that, the party had this, the party had lighting, the party had a lot of celebrities, that wine, there were drinks, there was food. This is detailed. These people are not detailed. They are very generic. They are very flashy. They just want to show off everything. I went for a party. I was called by this person. I have a business that is worth this much or worth that much, but this is not detailed. They just tell you stuff about yourself and then finish that conversation. So they're not very detailed, which is why this is wrong. Patients with this disorder usually lack emotions. No, they want to be the center of attraction for every damn thing. So they don't lack emotions. So this is wrong. Unfortunately, you will have to learn this information, which is again in our notes. We have made pointers where we have clearly written that there is a genetic link for this condition. Yes, this is this personality disorder is genetic. So all those who have the notes can uh, get know you know where to look for. So this is not genetic. This is genetic. There is a genetic link for this disorder. These patients, they use repression and dissociation. What does this mean? It means that these people, they're not very good with dealing with emotions. So they generally forget. They ignore and they fool their mind into tricking themselves that nothing has happened. For example, you failed an exam, but it's okay. It's just an exam. A piece of paper does not decide my future. This is repression. This is dissociation. Distracting yourself, curbing that feeling. So this is what these people do. People with histrionic disorder. Yeah, this is what they do. They want everything to be flashy, everything to look good on the outside, and even on the inside, they don't want to think about stuff. This disorder usually does not exhibit seductive or provocative behavior is absolutely wrong. So this is how you eliminate. In the exam, if you don't understand, if you don't know what the answer is, you start eliminating the other options. Usually in an exam, you can, if there are 5 options, you can easily eliminate 3 of them. The fight is between two. And options like these, options like option B, where there is no genetic link, this is a fact. These are things that are factual. This is where you have to get deep into the guidelines and look for relevant information, which is where study is going to help you. That we have dug deep into the guidelines, we have solved the relevant, past recalls, past question banks, and we have extracted information, put it in one place. So you have to understand where to look for things. Yeah. Let's go on for the next question. A 32-year-old accountant comes to the clinic because of increasing stress at work. Now he reports spending hours every night reckoning his financial calculations at home, even though they were already verified at home. He says, I just feel like I don't check it myself. He says, I just feel like if I don't check it myself again, something terrible will happen. He recognizes this behavior is excessive and irrational. Now, but he finds it very hard to stop it because he temporarily it relieves his anxiety. He denies hallucinations or delusions, and he says he is often tense and has little time for friends or hobbies. On further questioning, he explains that he likes rules and structure, but also feels distressed. When he is unable to stop his repetitive checking, he has no history of psychiatric illnesses. Which of the following is the most likely diagnosis? So I see B's. Come on, guys. This is a very easy question. Yeah, all for B. Come on, all for B. Thumbs up. Thumbs up. Yeah, so that's the wrong answer. That is absolutely wrong because this person is ego dystonic. The answer is not OCPD. The answer is OCD, and I intentionally did not put option E because I wanted some of you, which you did. This is ego dystonic, guys. What does ego dystonic mean? So I ask you to remember this point. What does he say? Here he says that he recognizes this behavior is excessive and irrational. So he knows what he is doing is not correct. So this is ego dystonic. It is not in sync with his ego. What does ego syntonic mean? Ego syntonic would have meant that he says that if I don't calculate and if I give it to somebody else to calculate, he is for sure going to do it wrong. So I only have to calculate because no one can do it like me. If I don't do it, it'll be wrong. This is ego syntonic. This is in sync with his ego. Every one of us has an ego. You may not admit it, but all of us have a certain level of ego. If our thinking is rational and it is against that ego, it is ego dystonic. So ego dystonic means I'm washing my hands again and again. I have OCD. I keep washing my hands, but I know this is nonsense. This is not, this is not helping me to flush the bacteria away. This is completely bullshit, but I'm still doing it. This is ego dystonic. But I keep doing it and I say, I know that, I have flushed out all the bacteria. No organism can touch me. This is ego syntonic. So this person has OCD, not OCPD. Is this point understood? Come on, guys. Come on, I need more thumbs ups. Yeah? Cool? Amazing. Thank you. So this is ego dystonic, and I got you. So every class we have one question like this. Now, last. I think, yes, last. A 12-year-old girl is brought to the office by a mother for concerns about worsening behavior and poor academic performance. The mother reports that the patient is often distracted. She struggles to finish her homework and forgets to bring books and assignments to school. At home, she frequently starts chores but she gets sidetracked and leaves them incomplete. The patient also has been called in by school several times for talking in class and interrupting teachers, which she explains as, I just get bored and I can't sit still. She often argues with teachers when they reprimand her, but calms down completely afterwards. She reports feeling frustrated because she can't focus like other kids and often gets in trouble even when she doesn't mean to. Physical examination and development are normal. Which of the following is the most likely diagnosis? I see a lot of B's. Come on, guys. B. Why not C? Why not C? Okay, tell me why not C? Tell me why not C? Okay, B, yes, but why not C? So age less than 18 is exactly Adishri. Thank you. Not aggressive. There are no signs of aggression in this question. It's all, you know, this person is impulsive. This person cannot sit still, which is why this is ADHD. It's attention deficit hyperactivity disorder. So why is it not C? Because no aggression. So this was the last question. This was all about personality disorders. And I hope personality disorders are now easy. When you get a question in your exam, you'll be able to solve it. And yeah, this is what we hope for. Now we have some certain announcements to make, and Dr. Alia will be sharing her slide now. I'll stop my screen sharing. Yeah.
Guys, I hope you all enjoyed this session. I mean, you will remember the steady study reference, okay? I really want you all to remember that reference in the exam. You should be remembering us because I will be promoting steady study and I'll be promoting so much that whatever Farhan has taught you today, you will be like, okay, Alia is this. Guys, we are planning a lot of things for you guys. So please show some love on our socials. I keep repeating. I think you all know that if I am talking, there are a few common phrases that I'm going to repeat again and again. And so you're used to it by now. I hope it's not annoying, but you guys have to deal with it. If you are listening to Farhan, you have to listen to me also.
Because Farhan listens to you.
Yeah. Okay.
Okay.
Thank you so much, guys. Do we have any questions in the chat box? I mean, it's open for Q&A. If you guys have any questions, you all can just put it in the chat box or you can unmute yourselves, guys. Now you can do that. I'll just stop sharing my screen. Okay. Do we have any questions? Okay, I'm,
No
I'm
questions.
surprised. Eh,
By
By
when can we
when
get digital notes? Give us time. It'll be soon. It'll be soon.
we
There are
will
some things.
update
There
you.
are some things that we have to deal with first. Once we deal with them, it'll be live.
Everyone knows about AMC. They're all
First
pros
time we
now,
have no
okay? They're
questions.
all pros
I
now.
think we have given all the information. Okay then.
Everything
If
is
there are
out there.
no
I think they've
questions,
seen all our reels and all our YouTube videos, so now they don't
amazing.
have any questions.
Amazing. Okay, so then we'll call it a night. Goodbye, everybody.
Okay.
Take care. Be safe.
Okay, guys. Bye, guys. Good
Okay.
night.
Bye bye.